So speaking of use cases, you went over a lot of like the collaboration hub idea of being able to build this place where you can go all over. And some of them sound a little, familiar to some who have been to a couple of healthcare conferences or panels. But Tom, you have been kind of pioneering a new kind of unique use case in behavioral health. Can you touch on kind of what that use case entails, and then also how the selection process of choosing Jive kind of came about, and the reason why you thought Jive was the right fit for your use case?
Well, I have to confess that I got very lucky because myself and my team were essentially process junkies in behavioral health care, which means that we're paying more attention to how do you deliver critical thinking to an affinity group. In our case, the affinity group were parents, spouses, caregivers of individuals who are managing a person with a psychiatric condition. So we came into the behavioral health care space that we've been in a lot of different domains, EAP, insurer, healthcare provider, and said everything around the payer system, the service delivery system is built around the patient. Patient information, outcomes of treatment, et cetera, but there's no deliverable around the caregiver. And ironically, when we looked at even public policy and said, gee, we have a national quality strategy from Obamacare, and two of our national priorities have to do with patient and family inclusion and treatment planning, nobody was giving any voice to how do you coalesce this collective voice of people who are stakeholders in behavioral health care, pay most of the bills, and by the way, pay for about $10 to $15 billion of the behavioral health care dollar. How do you bring all these voices together? Now me, again, as a process guy and as a systems guy, I knew nothing about tech, and I actually, frankly, got very lucky when I learned about Jive. But there were sort of three characteristics that we were looking at. The first one had to do with community culture. So we are sort of shepherds, if you will, meaning myself and my team, serving parents across the country, caregivers, et cetera. We're sort of shepherds of people who are fairly frail. They spend a lot of money. They exhaust a lot of emotional energy managing the life of the person who is the patient. So the patient goes into the hospital, goes to residential treatment or addiction treatment, or is an outpatient, and it's a 17-year-old with an eating disorder, a 25-year-old with schizophrenia, or a 45-year-old with bipolar disorder who's still at home, that there's no system that basically helps the caregiver with their own critical thinking. So we needed a platform that spoke to sort of the emotional intimacy of what we were trying to deliver. Our mission was we did not want parents or families to spend one more wasted minute, because what we heard from families from California to Maine was all we do is chase information that doesn't necessarily deliver a better quality of life for our kids or our family members. And one of the things I learned in my sort of deep dive into Community Roundtable, into the ComBlue data, and to everything about community was the best communities deliver a quality of life outcome for their users. And at the same time, we happened to learn about Jive and other platforms and said, well, that's all we're about. We're about a family member having a certain level of skills and staminas and support systems, coming into a community, learning new skills, new staminas, new supports, and then basically having a delta in their quality of life and then delivering that back to their son or daughter or spouse or whomever. So we needed a culture from a platform standpoint that sort of spoke to that intimacy, had the privacy, provided tremendous user authority to come in and share on their terms. That was very critical to us because we want to shepherd other people's experience and be respectful of it. The second thing we were looking for was obviously the technical piece. And I don't know if Ruth Neighbors is in here. Is Ruth in here? So the social edge people were very patient with us because this whole side of life was very new to us. That we knew what our vision was. We knew how we wanted to connect people. But we weren't really sure, well, okay, are you providing medical care? How do you get around HIPAA? Are you allowing the caregiver or the parent or the spouse or whomever to provide their point of view and their experience, but are they actually do they have permissions of the patient? So what we liked about the public places, private spaces aspect of Jive was we could create what we call organic autonomy, which is parents and families can come in and create their own groups and basically be anonymous and then share case histories. So if I'm a father of a 25-year-old son with bipolar disorder, I can come in and have anonymity, and then I can share my story as a case study. I'm TOC 1, 2, 3. I've got a son, 25 years old. These are his characteristics. This is his treatment history. These are the failures I've had in being a care manager for my son. And so people could come in and basically create their own public places for this. What was really exciting to us is we imagined a nation, frankly, where 1,000 mothers of sons or daughters with eating disorder could come together into one place and share information about, well, which residential program has good outcomes? Who's following best practices? What's the milieu of different treatment programs so that we can direct our community members to where people are delivering outcomes? And this was a real shocker for us. Can we create a community where families and insurers actually are on the same page? Because usually it's an adversarial relationship between the payer, the third-party payer, and the family. And we thought, well, insurers actually want to make sure they're paying for best practices and paying for outcomes that are then sustainable outside the treatment environment. Because what we know as rehab people and as treatment people is it's a lot easier to have an outcome for someone in the controlled environment. But once you send them back into their life, the payer, whether it's the parent or the insurance company, wants to make sure you can sustain that outcome when someone goes back to their life. So we looked at the public places as a way for families to be following each other. We looked at the private spaces as a way for us or our hosts, let's say a large EAP that wants to deliver this as a work-life product, so that they can create their own content and marry it with our sort of shepherding content. The third thing we were looking at was user outcomes. And this is sort of I don't know, I'm sort of smiling because it's kind of I had a real learning curve with this, but it's a story that has a happy ending. So when Social Edge was teaching us about Jive and particularly gamification, I looked at my user group, my affinity group, and thought, gamification with my people, I'm not sure, it feels a little too sort of kitschy. But then as I realized it was built on this self-determination theory, I realized that what it was actually doing, and this was my blind spot, it was moving people through these stages of having mastery, having autonomy, mastery, progress, purpose, and social connection, that what I wanted in my vision of teaching parents and caregivers to be more competent consumers of behavioral health care, the gamification platform was doing that. So we were providing content that actually provided autonomy for the parent or caregiver, that they can have control over something that historically has controlled them, that they can have mastery from a standpoint of having a new skill set, purpose in terms of having a means of objectives and moving through the platform, and then progress in terms of us being able to measure, and more importantly, the user being able to come in and say, oh, I had this level of emotional skill and stamina coming into this, and now I'm sort of skilled up and stamina up, and now I can actually see myself getting better over my time on the platform. And
Awesome.
then, of course, the social connection piece, and then, forgive me, this is how I am. I just keep talking.
It's okay. It's not like somebody next to you has that problem either. This way.
So the whole social connection piece is we know that parents and families around the country are like starving for connection to people who have lived experience. So this is a way for us to create a platform for people with lived experience who frankly trust the other parent or caregiver a lot of times more so than the clinical expert.
Awesome. It's, a great mission as well. We've heard before last year also, MD Anderson trying to, solve the mystery of curing cancer. Behavioral health is a very big topic right now, and everything you're doing is extremely positive change. So we're going to move over to